Good morning. My name is Tracy Trypuc. Welcome to Your Health Matters. Today, we will be discussing sports concussions. Now, I would like to welcome my guests. Dr. Michael Kennedy, he's a Chief Medical Officer at Expert Medical Care in Huntington, and he's also an attending physician at the Emergency Department at St. Francis Hospital. We also have with us today Elizabeth Gross Cohn. She's a doctorally prepared nurse researcher, a nurse practitioner and registered nurse, and she's the director for the Center for Health Innovation at Adelphi University. Thank you both for joining me today.
Thank you.
Thank you for having us.
Thanks. This question is for you, Elizabeth, if I may. Before we begin our discussion about concussions, can we talk about the work that you do at the Center for Health Innovation?
Sure, I'd love to. So the Center for Health Innovation seeks to become a regional and beyond resource for current and emergent health and healthcare needs at Adelphi University, utilizing the experts of Adelphi University and meeting the needs of our community. We're taking a community-based approach, so empowering communities to take control of their own health and really connecting communities on behalf of their health. And I'm started as the director there in July, and I'm very excited to be there.
Okay, thank you. Well, I'm excited to have you here. I know that you're going to have a lot to share. Your website is chi.adelphi, which is adelphi.edu. And so one of the ways that you achieve your goals is by hosting symposiums, correct? And the next symposium you have coming up is going to be with an expert panel discussion and lecture on sports concussions. Can you tell us a little about that?
Sure. So March 30th at the Alumni House, which is 154 Cambridge Avenue, we have a broad-based panel on sports concussions. It starts at 5:45 with a balance demonstration, but what I like about this panel and kind of the philosophy of CHI is that we bring together people with varying interests. So we have industry people who are advancing field-side medical testing, blood testing, balance, helmet researchers, and then doctors from the area, Winthrop and Dr. Kennedy. So it should be a very exciting panel.
And Dr. Kennedy is going to be one of the first speakers?
The first.
At the event? Yes, okay. Right. And so at the end of the show, then we're going to speak again about the symposium to remind everyone.
Sure, and we also have sports figures, as we mentioned. Pat LaFontaine will be there as well.
Okay. All right, so welcome, Dr. Kennedy.
Thank you for having me.
Yes, thank you for being here. You have over 20 years of experience in both emergency medicine and sports medicine. You've published and lectured extensively about emergency medicine and sports medicine, including athletic trauma, brain trauma, and concussions in the athlete. You also have been a field doctor. So could you explain to our viewers what a concussion is? And what are the hallmark signs and symptoms of a concussion?
Sure. Most people in the past have thought that in order to have a concussion, you've had to have sustained loss of consciousness. And so we're trying to educate everyone regarding, what is a concussion. And sort of there are really two hallmarks. One is confusion and some degree of amnesia. And there are other signs and symptoms that will develop both on the field and also post the injury, but you don't have to lose consciousness during impact. There's usually is going to be some degree of confusion. So those are the two hallmarks.
Okay. Are there differences in how a concussion may present in a child, adolescent, college age, or in an adult?
In general, the symptoms are pretty universal. Some people will have some, and some will have others. There can be headaches. There can be just like dizziness. There can be imbalance. There can be difficulty with memory. There could be different problems with recognition and cognition, higher level thinking, and those are the most common. Significant injuries will have maybe even visual disturbance, severe headaches followed by nauseousness and vomiting, very common pediatric type of symptom. But those are the range of types of symptoms that will occur in the pediatric, adolescent, and in the college and professional athletes.
Okay. So what can someone do in the first 24 hours post-concussion?
Well, I think it's sort of important to understand, like anything else in life, what is the gradation of the impact? What grade of we try to. The American College of Sports Medicine years ago came out with a very simple gradation of the degree of injury, grade 1, grade 2, grade 3, and they're based on the degree of amnesia, how long it lasts, the degree of loss of consciousness, how long that is, greater than 5 minutes or less than 5 minutes, and they've kind of grouped them into grade 1, 2, and 3. Now, 3 being the worst. Grade 3 is, let's just take 3 from the very beginning. 3 is someone who loses consciousness for greater than 5 minutes or has post-traumatic amnesia to the event greater than 24 hours, either one or both. So, you think about that. So that's a very different kind of head injury than somebody who has a grade 1 injury who may have just no loss of consciousness, a mild degree of amnesia or confusion. So you would expect the person who had a grade 3 injury would take a much longer period of time to recover. First 24 hours is understanding what gradation they're in. Do they need CAT scan imaging? Do they need to be seen in the emergency department? Do they need to have that kind of evaluation? That's the first sort of 24 hours. And then if something post-surgically or a surgical issue is sort of ruled out, epidural, subdural hematoma, subarachnoid hemorrhage, things like that structurally, then the first 24 hours is basically observation, is seeing if the athlete's symptoms start to become more advanced, or if they are stabilized, and that we basically make sure they do not put themselves at risk for a second injury.
Okay, all right, that's very important. So then what, depending upon the grade, what else can you tell us about the recovery process? And are there post-concussive symptoms?
Again, the recovery process now that has been implemented in New York State by legislation by Governor Cohn, that was brought initially by Senator Hannan from Garden City, was trying to standardize the return to play criteria and the recovery process for student athletes. And so initially there's a rest period where there's what we call a total timeout. Then the athlete is reassessed to see if they have any symptoms at rest. Okay. Do they have headache? Do they have confusion? Do they have nauseous vomiting? Are they having photophobia? Are they having sensitivity to light or to noise? And then we'll wait for a period of time. That could be a week. It could be 2 weeks where they become asymptomatic, and then at that point start to re-enter them back into some degree of physical activity, where light activity, and then aerobic activity, then sport-specific activity, and then what we call full contact. And again, depending upon their grade of injury, that recovery process could be 2 weeks, or it could be a month or 3 months. It is different for every athlete. It is different for every kind of head injury. It is different for different ages. And the recovery process is a period where there's an autoregulation process between the cardiovascular system, or the heart, and the brain, where there's a re-regulation of the autoregulation of blood flow between those two structures to get reset, and that rest period is very important for that process, or that healing process, to occur. And it's different for every athlete. It's different for every kind of head injury. And that's why monitoring and reevaluations are very important.
Okay. Now, because of this legislation, is it too soon to know the answer to my question here? But is there a pressure to return to play, and therefore possible underreporting of symptoms, or do you feel that with this legislation that has already started to turn the tide on that?
Well, I mean, you mean for years there's been underreporting of head injuries in general in athletics. I mean, probably for 20 years, the same statistic has been rolled out. There's about 250,000 concussive type of head injuries that occur in sports. It's been the same figure over and over again, until recently and this awareness has occurred, now there's more reporting. Now, what you're trying to ask is, with the new legislation, with the new awareness, is the reporting going up, and is there much more cautiousness going on forward? And I do think that the statistics are going to skyrocket. I think you're going to see more evidence of athletes coming forward and reporting their symptoms, and that's what I see what's going to happen. So we're going to be more startled, and you're going to see more players probably retiring earlier. I think you're going to see more people wanting more information about choosing whether their own child should participate in certain types of athletics, and what's the risks, and what are the risks, what are the real risks, both short-term and long-term.
Okay. Well, just as what you just said, this week, 24-year-old Chris Borland, a linebacker for the San Francisco 49ers, announced he was retiring because of concerns about his safety. And this news came just days after Patrick Willis, 30, announced he would retire rather than risk any further injury. Borland said he based his decision on the research that he had done and what he had experienced playing. And so, going back to what you were saying, do you think that we are beginning to see the start of a trend of athletes retiring because of greater awareness and research that they are doing about the risk that they are taking playing, and what they are witnessing while they are out there playing?
Athletes, as they move from, recreational athletics to amateur athletics to professional athletics, the pressures go higher. There's a certain amount of financial reward in our society and being an elite athlete and prestige. So what's going to happen is that I think a lot of athletes are concerned of the long term. Of what's my functionality going to be in 10 or 15 years from now if I continue to play professional athletics that require high degree of impact. The NFL is obviously in the spotlight of this. They've been in the spotlight this week, but you have to look at all collision and contact sports. You have to look at ice hockey is probably the most dangerous sport in America, both from a cervical spine injury standpoint and a head injury standpoint. Number one. So the questions have to be posed to them as well. We're looking at high school and college lacrosse players, high degree of concussions as well. I mean, high impact sport, and also probably underreporting of concussions both in female lacrosse players and in men. So every sport is sort of needs to kind of align themselves together, and I think the symposium is trying to reach out to both professional athletes, industry, the community, to the individual sports organizations to kind of, in some ways, say, listen, we should not all be operating in our own column. We need to integrate and work together for the solution to this. And I think that's for the future. Athletes are going to have to make tough decisions regarding their livelihood, whether they are going to be able to continue. Or can the sports can they be made safer with lower risk? There'll always be a risk, in these kinds of sports. But can we lower the risk?
Okay. Well, so what do you see on the horizon for better diagnostic, criteria or for concussions that might help make the diagnoses faster, or if there are other things on the horizon that will help find out exactly what grade it is?
I kind of, in my years of emergency medicine, I kind of, always look at other areas that we've been able to advance. Let's say in cardiology, years ago, if you had a heart attack, you were put in the ICU, you were given aspirin, and then, your heart or your symptoms were at rest, if you will, and you were monitored and given oxygen. Now, the advancement of blood testing, with different troponin levels, we can make early diagnoses. We can bring people to the cath lab early and provide intervention, and have, and that treatment has vastly revolutionized the area of cardiac care. And I hope that in neurology we'll be able to do the same thing. I think that, I hope that we'll be at some point be able to maybe draw what they call a brain peptide level, and objectively know the degree of injury that the brain has sustained, follow those levels, through research, and say, along with clinically watching the athlete, and be able to come up with an idea of, objectively when they should go back. Are they fully recovered? So I think we're sort of on the forefront in terms of, not only clinically, but, diagnostically being able to truly evaluate an athlete's brain injury. So I'm excited, actually. Maybe with this awareness and with all the players and stakeholders working together, there'll be more emphasis on research, and there'll be advances in the way we, and actually, a whole nother paradigm will be instituted in the care of brain injury and in athletic trauma. And part of that is doing programs like this. Getting people to continue to think about this and how we could do it better.
Okay. Your website is www.expertmedicalcare, all one word, expertmedicalcare.com.
Yes.
Okay.
There are various articles on athletic trauma or athletic injuries that can be read and accessed, and that may give people more information about pediatric athletic injuries, head injuries, cardiovascular assessments in athletes, sports-specific titles regarding different sports, including football, ice hockey, lacrosse. So again, more information is better.
Okay. And do you have anything that you could say for our viewers who are parents about safety that they could maybe, discuss with their coaches or their family physician to help them in making the hard decisions about whether or not their child should play a certain sport, or if they do decide to play a certain sport, if they're wearing the proper gear? Is there...
I mean, the parents should be very involved in the process and in the decision process of, what they feel comfortable for their child, what sports they should be involved with. And I think it's really important. I've been a school physician for several districts for over 20 years. Most of the kids who are involved in sports and their parents know who I am. They know I'm the chief medical officer of that district. They know that I'm the go-to person. And I think the parents should know, who the school nurse is, who the physician is in the district, and if they have questions or concerns regarding an injury, a head injury, they should have the ability to have an open discussion with that physician. Every student who sustains a head injury in the districts that I'm involved with, in Valley Stream and in East Williston, I see directly and I clear them prior to going back to sports. I always have and I always will.
Okay.
So it's a very hands-on process. Now with the new legislation and the stepwise return to play criteria, it's become more formalized, which is great. But the parents should take an active role, know who the go-to physician is in the district, have open discussions, really understand the return to play criteria, and understand that it may take longer for their particular child to go back, even though they may, want the child to return, and what that process is, and have that open communication. I think that's very important in terms of going forward.
Okay. Thank you, Dr. Kennedy, for your expertise on this matter.
Thank you.
It's very important. So, Elizabeth, can we just talk again about Adelphi University Center for Health Innovation, or CHI? About, again, you were talking about how it was a community-based resource. So can you talk a little bit about some of the symposiums that you have and how you decide which ones you pick and how you chose to have this one here on sports concussions?
Sure, and maybe I'll work backwards through that to
Okay.
comment a little bit of that from what Dr. Kennedy said. So as Dr. Kennedy said, we're bringing together parents, coaches, industry, athletes, really people in the community. Concussions is a community problem. It's a cultural problem of sports. It's an education for parents and coaches and children who play. So to solve some of these really vexing public health problems, we bring together these really multidisciplinary panels and talk about what we can do as a community to address it. So this one is, as we said, March 30th at Adelphi University, and people can register. It's free. But you have to register on our website, which you gave, the CHI website. That panel actually includes the person who, with the field side test, blood test is being developed in Melville, and we actually have Dr. Ann Cornell Bell who will be speaking on the development of that blood test. It's like a cardiac enzyme, but for concussion. So it should be a very wonderful panel. The panel that we did in the fall was on Ebola. Sam Stanley from Stony Brook spoke. We had the CEOs and presidents of hospitals, but also directors of infectious disease and nurse researchers who worked in Sierra Leone. And it was really a very powerful panel thinking about what is currently happening and then what we can do as a community to address it. And it was one of the earlier panels, I think one of the earliest ones on Long Island, to really delve into the issues that surround that, including the public health implications.
Okay, that's great. And so can you tell us the rest of the panelists for this symposium?
Sure, and it's co-sponsored by Winthrop University Hospital, so it's Dr. Kevin Curley, Dr. Mike Grossman, Pat LaFontaine, who retired from sports after multiple concussions and then founded an organization to look into sports concussions, Dr. Ann Cornell Bell, who's looking at the blood test, Rupi Joel, also a doctor from Winthrop University Hospital, and Don Groshin, who speaks on the balance exercises that can be used to return people to sports. So it should be a great panel. And we've invited local coaches from all the local areas so that we can all be on the same page in addressing how we think about concussions and possibly reducing them.
And again, your website is chi.adelphi.edu. And I look forward to being there.
Oh, and we look forward to having you.
So, okay, well, thank you very much. Any final thoughts, Dr. Kennedy?
Well, again, I think it's going to be a great symposium. A couple of years ago, we invited the different school districts and the medical personnel in the Huntington area and Suffolk County to our symposium at Huntington High School. This is sort of taking it to the next level. Getting more people, more community interest involved, and more medical professionals in the industry. And again, we just keep the ball rolling, keep the awareness going, and I think that it's going to be extremely positive for everyone.
And Elizabeth, any final thoughts?
No, thank you for having us, and I look forward to continuing the dialogue.
Yes. Well, I'm glad you're here. So I would like to thank my guests today, Dr. Michael Kennedy. He's the Chief Medical Officer at Expert Medical Care in Huntington and an attending physician at the Emergency Department at St. Francis Hospital. And Elizabeth Gross Cohn, she is a doctorally prepared nurse, researcher, and a nurse practitioner and RN, and she is the Director for the Center for Health Innovation at Adelphi University. Thank you for the work that you do, for educating the public about this important public health topic. I appreciate your time today.
Thank you.
Thank you.
Please tune in next week for another Your Health Matters with Tracy Trypuc, when my guest will be Suffolk County Legislator Monica Martinez as we discuss important public health and environmental health issues in Suffolk County. Have a safe and healthy day.